Welcome and thanks for joining us today. I'm Keith Lowcamp, Senior Director of Healthcare Industry Strategy here at Workday. I'm your host for today's conversation, Disrupted or Disruptor, the evolving healthcare industry landscape. Joining me today is Dina Kraft, our Global Head of Go-to-Market here at Workday, and we're looking forward to a really interesting discussion about the future of the healthcare industry. If you have any questions throughout today's discussion, share your thoughts with us on Twitter using hashtag WDayChats.
Say that 3 times
Yes,
fast.
hashtag WDayChats. So welcome, Dina. Earlier this year, you joined Workday to head up our go-to-market team. And you have a really interesting background that you bring to Workday. Can you share a little bit about your background and your experiences?
Oh, sure, Keith, and so happy to be here today. So prior to joining Workday, I was fortunate to have experiences working both for and with some of the leading healthcare provider organizations in the country. So really my experience falls in 2 buckets. In one, I worked directly for a large adult health system as well as a leading pediatric institution. And the other part of my career was in the consulting space where I worked mostly with technology and data to help companies accelerate performance.
So you've worked directly with the provider, you've worked with technology, you worked with data, you've also worked in an advisory role. You must have a lot of really interesting perspectives on what's going on in the industry.
Well, it's been an interesting adventure for sure, and I feel really privileged to have unique experiences and perspectives that have given me a flavor for the breadth and depth of issues that we face. Mm-hmm. And while consulting absolutely provided a diversity of experiences, it wasn't until I worked directly for a healthcare provider that I started to really appreciate the complexities and multidimensional issues that each organization faced and really the industry faces as a whole. And by no means do I have this all figured out. I think with the pace of change in healthcare, we will all be students of this industry for time to come.
Yeah, I mean, you're right. This pace of change is really dramatic, but of course, change isn't new. I mean,
That's right.
The healthcare industry has been undergoing change for really a number of years, whether it's due to regulatory changes or it's increasing mergers and acquisitions, new technology, and now a lot of disruptive entrants, folks like Amazon as well. And, of course, the scope of change often seems really daunting and challenging. Yeah. But what do you think is different about change now?
Yeah, you're right, Keith. We've been talking about change and transformation for a long time in healthcare, mm-hmm. but I think what's different now is that we're on the brink of some just really exciting possibilities. So for the first time in history, we have this convergence of science mm-hmm. and technology. And so let's talk a little bit about the science part, right? So if you and I graduated medical school in 1950, it would have taken 50 years, essentially our whole career and then some, for the amount of medical knowledge available to have doubled.
Right.
Now, contrast that with if we would have started medical school in 2010, I think the fact is that if by the time we finished our education, our required training, the medical information would have doubled 3 times. Well, projections now are that by as soon as next year, the amount of medical knowledge available will double every 73 days. So there's just an enormous amount of discovery that's available that's giving us a whole new world of science that didn't exist before. Now, in the same kind of dimension of what we're talking about, there's also this emergence of personal health data. So whether that's from our wearables or our phones or, for a couple $100, you and I can get our DNA analyzed or our food issues analyzed. And so we have all of this personal data. We have all this health and science data that's coming to fruition. And at the same time, we're seeing amazing innovation in technology because without the technology to really be able to consume it, there's not a lot of utility for the data that's coming to the market.
Yeah, it's really amazing to see how much technology has changed over the last few years. We have so much more data about patients and that can help us better diagnose, better treat, better prevent illness as well. And with this, most providers now have made that investment in the EMR systems to really lay the foundation and are investing in analytics and new technology, predictive technologies, AI, machine learning that are really helping them provide better care as well and help analyze that data and make better predictions that I think can really impact the care we give to individual patients as well as whole communities.
Yeah, that's exactly right. And we are just scratching the surface, I think, of what's possible with machine learning and AI and blockchain. And the technology now exists to have a true interoperability of this data where we can take health data and financial data and social determinants of health, as well as human behavior data. And that's going to help us really think about what are the drivers of health and how do we shift behavior to take advantage of what we know is driving health. And so, this is giving us endless possibilities to truly shift our focus and to take a different crack at healthcare as we know it.
Well, and so a lot of the investment has been focused on using this technology to provide care, but it's really exciting to see that technology also sort of permeate the other aspects of the health system and really in the administrative side.
Yes.
And we're seeing it being used for things to help manage retention risk, for example, or provide new ways to interact with systems, whether it's through voice or texting back and forth with your system, and as well as using machine learning to really look for anomalies and help make recommendations as well. In its most recent Futurescape, IDC really predicted that 25% of business processes will be impacted by this new technology and artificial intelligence as well, and that health systems really be applying that. So I think we're seeing a lot of dramatic changes and investment in the science and technology, and it does feel like we're sort of at that point where some of the seismic change could actually happen.
I think you're right, and it's also absolutely necessary.
Yeah, I mean, I couldn't agree more. Now, we've heard a lot of doom and gloom about the healthcare industry. We always hear all those predictions about how healthcare is broken. But, what is really different now, and why is it so important and necessary now to change? And where's there kind of that hope as well?
Yeah, we talked about what's different now is the possibility, but also the current state of healthcare just is not sustainable. So predictions are saying that in just a few years, healthcare will represent 20% of our GDP. So we're spending a lot of money on healthcare, but our condition as a nation just continues to decline from a health perspective. Right. And then the opinions on how to fix healthcare really vary, and I won't get into any of the political opinions, etc. But we all agree that if we're going to make changes, we've got to focus on well care versus sick care. And frankly, we just cannot afford as individuals, as families, as providers, as a nation, we can't afford the current state of healthcare. Now, even if we were okay with status quo, we have an impending talent crisis that's happening within healthcare, most specifically with providers and clinicians. So we just simply do not have enough physicians and advanced practice providers and nurses to meet current state demand.
Yeah, and I mean that's really a great point. Is there's so much time is focused on the cost of insurance and the actual cost to deliver care, but there's so many more pressures on the healthcare system that are really putting pressure on the margins and particularly that labor shortage that you mentioned.
Yeah, it's that classic example of what happens, right, when supply or when demand outpaces supply, costs go up. So the cost of talent, right, continues to go up. Physicians, advanced practice providers, nurses continue to push the price for their services up. And remember, providers now are employing more physicians directly than they ever have before. So they're bearing the burden of that full salary cost, oftentimes without a corresponding increase in productivity. So that's creating a margin gap that we've got to figure out how to fill elsewhere. And then on the same side of the equation, we have our supply costs also increasing. So as you know, talent and supply, they're the two biggest drivers in healthcare, and we already have some pretty dire financial conditions in most provider organizations today. So to see those costs continue to escalate is absolutely concerning.
Yeah, and I think there's this big demand for sort of really to look at how changing, in addition to those pressures on costs, changing the way we actually deliver care and get more innovative. And,
that's right.
And I think the consumers are demanding the change as well.
Yeah. Absolutely. We have become a society that we want what we want, when we want it, where we want it. And, we've talked a long time in healthcare about getting care close to home, and that's still an endeavor we should try to pursue. But really, we want to pick up our phone and be consulted by a physician, or better yet, we want Alexa or Siri to remind us of what we might need to do for health. We want somebody to think about it for us.
Yeah, I mean, KPMG noted in their 2030 report, where they're basically talking all about consumerism, how both the majority of Gen Xers and millennials would basically would want their appointments online, and they would make a provider choice on that. And so, really, you're seeing our expectations as healthcare consumers mirror our expectations as regular consumers, right? We want that experience to be like we have at home. But what's also interesting is seeing then the employees of the health systems are also expecting that from the systems they use within the health system themselves. They want to have a consumer-like experience. They want to be engaged when they're using their HR, finance, and supply chain system, and they want everything to be as easy as ordering shoes online.
That's right. We all want radical convenience, and we are seeing innovations in the back office. I mean, we're working on chatbots that allow folks to speak in natural language to get tasks accomplished, and we're seeing artificial intelligence and machine learning really being infused to administrative and clinical settings and operations. And there are exciting discoveries popping up all over the place. As a matter of fact, I'll share that I was talking with one health system 2 weeks ago, and they're working with an automobile manufacturer so that we can take a look at when we hold our hands on a steering wheel, the steering wheel is taking in some of our vital signs. When we look into the rear view mirror, they're doing a retinal scan. I mean, that's pretty exciting stuff. Yeah.
Yeah, I don't know if they should measure me during rush hour.
That's true.
That's good.
True.
Yeah.
Just because you can doesn't mean that you should.
Yes. Well, I mean, that's really cool stuff. But as we sort of think about it, it still seems like there's a lot of hard work to get there.
Yeah.
How do you think healthcare organizations and the industry in general will be able to get there? What actions should they be taking?
Well, I don't think there's an easy answer to this question, and there's certainly not a silver bullet. But one thing that I know is that if we're truly going to take advantage of all of these possibilities and this convergence of science and technology and shift to this world of possibility and thrive versus just survive, it's going to take all of us to think differently. Patients, providers, health systems, health plans, pharma, technology, you name it. And we've already seen the lines of these traditional subsegments of healthcare start to blur, and I think we'll continue to see more of that because, frankly, that data exists all over the place, that technology exists all over the place, and so we've got to have an ecosystem to bring it together. And, change is hard. For me to change, it's hard. For an organization to change, it's hard. And sometimes little things can help. So I'll give you an example. I worked with a leader at one of the provider organizations, and each time there's a problem or an issue that gets presented on the table, it's really human nature, and it's easy to say the 100 reasons why a problem exists or 100 reasons why a solution won't work. And this leader just had a great way of bringing to the table, well, how might we, right? How might we try to do something new? How might we solve this problem? And it just gave us a different way of thinking. And I think when you're thinking about how might we, you're more open to collaborating outside of normal lines. And, I was with a healthcare organization a couple of weeks ago, and they're challenging all of their leaders to think like futurists, which I think is really exciting and probably a first step for us to really take advantage of all of the possibilities that exist.
I like that idea of challenging people to think like futurists. Yeah. So as you look forward, what do you think one of the biggest barriers will be to transformation?
Yeah. So, there are obviously a lot of barriers that exist. The regulatory barriers, just change barriers, et cetera. But, if we're really going to think like futurists, if we're going to capitalize on all of the possibilities, we have to figure out how to minimize all the minutia to focus on the mission. Yeah. So, we are all, no matter what your role is, if you're in a provider office, if you are a technology provider, whatever you're doing, our days are so consumed with day-to-day noise, right? So if I reflect back to my time as a leader in a provider organization, I would have very big, lofty strategic goals that I needed to work on, but that could be completely derailed in a moment's notice because something very administrative didn't go right? So the books, the numbers weren't adding up, or a benefits claim didn't get processed, or payroll was incorrect. And so I think if we're going to make this shift, we've got to free up our time of focusing on all of that minutia, all of that noise, and really spend our time focusing on the things that are going to help us better fulfill our mission.
Yeah. So, I mean, you gave a great example earlier about a leader who sort of challenged organizations to say, how might we? Do you have additional examples of leaders of organizations that are really doing a great job of helping to break down these barriers?
I do. I think one thing to point out is that we've seen kind of an infusion of leadership and operating principles from other industries coming into healthcare, namely from manufacturing. And, we kind of need to be a little bit careful and a little bit sensitive because nobody who's providing patient care wants to.
It's not like making a car,
That's
right?
exactly right. That's exactly right. However, the lean methodologies and specifically the leadership culture that has to exist for lean principles to work have done an enormous benefit for healthcare organizations. So I've been a part of a couple of performance opportunities where lean was kind of at the core of what we were doing. And not only did we accomplish the goals that we set out to in the different functional areas, but we also kind of taught new behavior, and we saw just kind of breathe life into individuals and teams to think differently and to feel empowered to not only fix things but to look for other things to fix. So I think that's a great example of something that we're doing in healthcare to take advantage of lessons that have been learned in other places.
Well, lean is such a great example because it can be applied not just to traditional areas like supply chain. You can also do lean events on how you're actually delivering an episode of care
That's
and
exactly
look for
right.
ways to reduce waste and reduce variation. One example, another example that comes to mind for me is one of our customers has really intentionally decided to invest in innovation, an innovation team, really building off their investments in cloud technology, and is really staffing up and asking them to go look for opportunities to really make dramatic change, and making that investment in that.
Yeah, we're seeing change. We've talked about like the blending of these lines and the subsegments. We've talked about kind of streamlining operations. We're also seeing a ton of innovation in just the business models of healthcare, right? So traditional competitors are now partnering more frequently than I think we could have ever predicted. Healthcare organizations are taking the innovations that they're creating and they're figuring out how to commercialize that for different revenue streams. And so we're entering into businesses and markets that, again, I don't think that we could have ever have foreseen. But at the same time, we are still struggling with some of the basics. So as you mentioned before, consumers make decisions on how easy it is to schedule, and there are a number of provider organizations that are still trying to centralize scheduling, get scheduling online, and we also have just very real access issues, right? So I don't know if you've tried to get a primary care provider lately. It is not a lot of fun, and it's been a while since I looked at the data, but as I think 2 years ago, if in Boston, if you wanted to see a family medicine provider, the average wait time was over 100 days, even if you had an established relationship. So, we still have a lot of work to do.
Well, I mean, hopefully, and I do. Hopefully, it's shifting. I think it is, because this massive investment, as we talked about earlier, in EMR over the past decade, has really given the health systems, I think, a really solid platform and foundation to support the delivery of care, help make better decisions as well. But it's also a platform to deliver a more digitized patient experience, which I think a lot of the us as consumers are looking for as well. One analyst firm basically anticipated that 60% of healthcare providers will be making it a top strategic priority to invest in the digital experience really in 2020. So, I mean, I think we're going to see some of that change and that investment in the consumerism. Unfortunately, I think in some cases, though, that massive EMR investment took away from investment in maybe the administrative side, the
That's
employee experiences as well, particularly across non-clinical areas of the organization. So to me, that's an untapped opportunity today.
Right. And it gets back to that conversation we were just having about, the small rocks and the big rocks. So if we're going to set our sights on the mission, on the big rocks, we've got to get rid of those smaller rocks that make us stumble. And I think that's why, I think you're right, the EMR phase, not that we're ever done with EMR, but that's largely behind us. And now we're focusing on back-end operations. And that's why, organizations like Workday are hearing so much from particularly the provider community to have some help with streamlining those back-end operations.
Yeah, so we're just talking some about technology and innovation, and that that innovation also seems to be creating needs for different skill sets as well. I mean, different
That's
roles,
right.
different skill sets. You mentioned bringing in skill set from manufacturing, but talent is really changing across the organization.
Yeah, it is. And there are a couple of areas where I think we're seeing some pretty big talent changes, not to mention the fact that more than half of our workforces in healthcare are millennials at this point, and we have more generations working together than ever before. But in addition to that, we're seeing more initiatives being led by physicians. So there is an enormous demand for physician leaders from CEO on down. And we're also looking at an upskilling of traditional roles, particularly in supply chain and human resources. So again, talent and supplies tend to carry the burden of most of the cost equation in healthcare. And so we're trying to make sure that we figure that out and we have talent that can be very intentional and strategic about how to optimize both of those resources long term. The other thing that we're seeing, I was going to say it was an emergence, but it's really been an evolution of some new roles that are helping us think about the world of possibilities. So, chief strategy officers, chief innovation officers, chief population officers. Some of those have existed for a while, but the way that they look today, it's very different than the way that they looked a few years ago.
Yeah, definitely seeing a lot of new roles. And going back to supply chain in particular, and that role has evolved so much over the years, and the expectations and the importance within the leadership of the health system, and the skill set has really changed as well, where it's more important to have analytics skills, more important to have great communication skills, good negotiation skills, because more and more it's moving away from just pressuring suppliers to get the
That's
lowest
right.
cost, right? It's about creating a strategic relationship with those suppliers, looking for those win-win opportunities to go at risk, to really focus those contracts on outcomes. And there's a lot more focus on working within the system to look at how do you reduce variation and look to reduce costs through through different means as well.
The big rocks.
The big rocks is right. That's right. And so one health system that I spoke with, they really had an intention, their supply chain organization, to hire MBAs straight out of business school. And of course, that talent costs more, but they made the justification that they would expect to get a 10-to-1 return on that investment. So, investing in this new talent to really make a better and higher return.
Yeah, absolutely.
Yeah.
Absolutely.
So, we've talked about kind of these changing roles and the need to focus on a new talent, but we always hear that healthcare is risk adverse, right? And so it's often tough to overcome the conservative nature of the industry. So what guidance would you give to help address this?
Yeah, well, I think we've touched on this a little bit, but healthcare is conservative for a reason, right? Any kind of change introduces some amount of risk, and we've been taught to minimize risks because we're trying to protect patient safety and clinical outcomes. And so that's still critically important. So it's kind of this balance between how do we become strong innovators and at the same time maintain our strong operator DNA, right? Many organizations have become very successful because of the strong operator DNA that they have. And so we have to teach our leaders how to lean into change in a meaningful way that is minimizing risk, of course, to the patient, while at the same time being those operators that frankly they've been doing very well for a long time. So we got to keep our eye on the possibilities, and we also have to keep our eye on running our current state businesses.
Yeah, great point about balancing those two priorities. Okay, so the last question for
Okay.
you, the big one here. What message would you like to leave everyone with today?
Oh, gee. So, we've talked about a lot today, right? We've talked about the enormous possibility that exists because of this convergence of science and technology.
Yeah.
And we've also talked about why it's necessary. So current state healthcare just is not sustainable no matter who you talk to. We've acknowledged that it's hard though. There are things barriers that we need to overcome, and it's heavy lifting. But I think the thing I'd leave everyone with is that it is so very worth it, right? So all it takes is for us to experience a health episode, whether that's ourselves or for a family member, to get a bird's eye view into the heartbreaking complexities of healthcare. And I'd like to imagine a world where we're not inundated with chronic conditions and behavioral health issues, and where we don't have to worry about health inequities due to social determinants of health. And so I'm excited about what the world looks like in the future. I know you are too, and I'm excited to be on this journey, and hope that everyone listening will also join us on the journey.
Well, I'm excited to join you on the journey, Dina. And so thank you, Dina, for your perspectives today. And thank you, our viewers, for watching. Share your comments below, and let's continue the discussion. That's a wrap for today. So we'll see you next month for #WDayChats.